To relieve hip pain, we're going to go through some exercises that cover these 4 basic concepts. The first is decompressing the femur bone from the hip socket. The second is mobilizing the hip joint. It is a spherical ball and socket joint, so meaning it moves in a circle or has that potential to. 3, hip stabilization, primarily using our pelvic gluteal muscles. And 4, dynamic movement, putting it all together. How can we prepare our body to move through life? Okay, so the first thing we're going to do is come onto hands and knees in the quadruped position, tucking the toes, and we're just going to push the pelvis back. There's a posterior glide, meaning backward glide of the femur bone in the socket, and then we're gonna come forward. And I feel a little opening along the hip crease here. So shift the weight forward enough to feel opening, and then we're going to push back. We just go back and forth a few times here. After going through this maybe 8 times, up to 12 times, I'm gonna grab a block, or maybe it's a book, and come back to that position. Now, this leg is going to be moving. So I'm going to start with the knees close together, and just like we were pushing back, I'm going to pull that femur back far into the pelvis, and then I'm going to shift it down, 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 down towards the ground. Good, decompressing it from the socket, lifting and lowering. And notice I'm not using my back to do this, right? I'm trying to do it from the pelvis here. Up and down, and we'll do this, maybe 8 times or so. Okay, from here, stabilization or mobilization, I can stay on my block, walking the hands out. I'm going to start with a short lever as I move through the hip. Make sure to explore both directions. And then I'm going to tuck this knee behind the right, and maybe only the shin bones cover, that's fine. But then we push into the hip and the head comes down, and you'll feel a stretch on that opposite glute here while getting some internal rotation of the tucked leg. Coming forward, good. You can even step this leg all the way forward into a lunge. Allow the hips to open. So as much as you want to explore that. Okay, now we move into stabilization. So I'm still on my block. If I need to, I can move the block. I can come down to the forearms. We're going to start lifting and lowering this leg. And notice that I'm trying to keep my spine stable and use my glute and my hamstring to do the work. So rather than this, which we often see, especially with low back pain, the low back likes to initiate. So instead, we're gonna hold it still. I'm really digging my right toes into the ground. Good, and I can try this at a different angle. It'll work slightly different gluteal muscles. Maybe 8 reps of each kind. Good. So we have decompression, mobilization, stabilization. Now we come into some dynamic movement. Okay, so for the dynamic movement, I'm gonna step 1 foot forward. I have my hand on the block. I'm gonna lift my back knee and lower that knee towards the ground. Now this is a pretty tight compression in the other hip. So if we need to, we can lift up and practice bending and lengthening. What I'm not trying to do is my deepest lunge. Instead, trying to feel the way that the hips, that the glute muscles hug the hips as we move. Finally, we bring this foot forward, stand all the way up, and then we're gonna transition into a lunge. So we're gonna go through that full range, stepping up, lengthening, coming down, moving out. I use the block to bring the ground closer to my body because the primary purpose is to retrain the activation pattern. So it's great to bring in sources of support like the block.